coronavirus. Is it safe to travel this summer? Winter is almost over, spring is coming, then summer is around the corner. As pandemic stay-at-home restrictions loosen, is it okay to fly again? What about going on a beach vacation or a road trip, or sharing a rental house with friends? Experts assess pretty much every summer travel scenario and tell how to minimize COVID-19 risk. We've been under lockdown all winter, spring, and summer is almost here. But it's a COVID-19 summer, and it likely won't look like any other in modern history. The wanderlust is strong. People want to travel. It's a wonderful part of life. But it's a really challenging time to make future plans because the environment is so difficult right now. If you're thinking about traveling later this summer, factor in the possibility that your destination may face a new outbreak before you arrive. You can make your plans now for a destination that appears to be relatively safe, but it may not be safe 2 to 3 weeks later. Be sure to get advice shortly before you go because the situation there may have changed. No matter where you plan to travel during the pandemic, consider various health risks. You could get sick with COVID-19 while away from home and need to find medical care and self-quarantine. There's also a chance you won't know you're infected, if you're asymptomatic or pre-symptomatic, and you could spread the disease to others at your destination. Or you could bring it back to your hometown. Avoiding any non-essential travel this summer. If you do need to travel or you're set on a getaway of some kind, take note of any quarantine regulations for visitors to your destination, and keep in mind that you may be required to self-quarantine when you return home. The experts say that whether or not you're traveling, it's important to protect yourself and others by maintaining a social distance of at least 6 feet, wearing a mask or face covering, and washing your hands frequently. We're not talking about risk elimination. We're talking about risk reduction. The only way to eliminate risk is to close your bedroom door and not go out. Your COVID-19 Summer Safety Guide. Get on an airplane. After losing billions of dollars to the COVID-19 crisis this spring, airlines are trying to lure travelers back with ramped-up safety measures, from requiring masks at the airport and on board, to disinfecting planes using electrostatic spraying, to introducing contactless service and social distancing protocols. Some airlines are promising to run flights at 50 to 60% capacity, while others are offering travelers the option to rebook if a plane looks too full. Passengers bargaining on a certain amount of distance from others in the air may not find the seating conditions to their liking. Many are complaining that flights are too packed. My advice is that until we know more about this virus, air travel would be a risky thing to do. They may have wiped that plane down to make it sparkling clean, but you're going to be in the cabin with all these other people. You wouldn't know about where they've been. The experts advise wiping down all the surfaces around your seat with disinfectant and cleaning your hands with soap or alcohol gel frequently. Gather information about a specific flight before you pay for it. An intelligent consumer can make a phone call before booking a flight and ask what precautions they're taking. You have to be skeptical. Even if you've wiped down the surfaces around you and the seats next to you are empty, you cannot catch COVID-19 by breathing the air on your flight. The air is pulled in at 30,000 feet then mixed with the air in the cabin. And it's more HEPA filtered than operating rooms, so it's very clean air. If someone who has the infection is sitting in row 11 and you're sitting in row 10, then that's harder to control. Sick passengers sitting several rows away from you may pose a risk too, as can an infected person walking down the aisle. An expert say that transmission on planes showed that droplets of the coronavirus can stay suspended in the cabin air for a while, up to 10 seconds for small droplets and as long as 4 minutes for large ones, and can blow around the cabin before getting filtered. If you do fly, wear a tight-fitting mask. A surgical or 3-layered model is best, since N95 masks still need to be reserved for healthcare workers, and make sure it covers both your nose and mouth. Avoid touching your face at all or taking off the mask to eat during the flight. If you do take off the mask, it's important to wash your hands, because you may touch the outer surface of the mask and your hands may be contaminated. Follow the same mask wearing and hand hygiene precautions at the airport, and avoid crowded areas. If you're checking luggage, It's a good idea to wipe it down with disinfectant after you pick it up at baggage claim. You can use the bathroom on board. In an ideal scenario, you'd skip it. But if you have to use the toilet on a plane, or in any setting outside your home, maintain your distance from others in line, keep your mask on, and clean your hands thoroughly afterward. Is there a risk of catching COVID-19 from aerosolized particles caused by a toilet flush? No such cases have been documented yet, and experts currently believe the risk is minimal. So far, we haven't really been able to show that you can pick up COVID-19 from contaminated water in a toilet. But do flushes release small droplets, and do they go far away? Yes, they do. Is that going to cause you to pick up COVID-19? You can take a train or a bus. Most transportation companies, just like airlines, are stepping up safety protocols. Amtrak is requiring masks for staff and customers, disinfecting its trains before each trip, and offering only carry-out food or drinks in the dining car. It is also promising to fill up reserved seats to no more than 50% capacity. Trains give passengers more control over where to sit than planes do, particularly in the United States, where trains tend to be less crowded in general than in other countries. But as with airplanes, it's important to disinfect the surfaces around you and be vigilant about wearing a mask and having good hand hygiene. Bus companies like Greyhound are also introducing enhanced disinfection methods and requiring masks for staff and most customers. Taking the bus is riskier. It's a smaller space and more confined. Take a cruise now. You'd have a hard time getting on a cruise ship now even if you wanted to, since many cruise lines have cancelled departures throughout the year of 2020. But if the ships start boarding again later this summer, it's best to hold off for a while. We've all heard the unfortunate stories about the cruise ships where so many people became infected and got stranded on the ships for weeks. On a cruise where there might be anywhere from several hundred to several thousand people, it can be very difficult to socially isolate yourself. I think being on a cruise ship could become a relatively significant risk for contracting the virus. It's unfair because they, like the airlines, are struggling quite a bit. How safe is a long-distance road trip? Driving to your destination may sound like the right move, since you likely won't come into contact with as many people as you would on a plane, train, bus, or ship. But plan ahead to make your trip as safe as possible and bring masks, disinfectant wipes, and hand sanitizer. In a vehicle, you have fewer contacts. However, you still encounter possible exposures outside of your typical community. When you stop to get gas, if you have to stop and stay the night somewhere. Any new contact increases the risk of exposure to COVID-19. A trip you can make in your own car, in one day and without stopping, is a safer scenario. If you're renting a car, even though some rental agencies are promising to disinfect high-touch surfaces in a car before turning it over to the next renter, you should wipe those areas down yourself. Should you worry about catching an infection from the air in the car if a previous passenger had the virus, that's a pretty small risk. It's unlikely that they're going to get out of the car and you're going to get into it after a short time, since staff would need to process paperwork and clean the car before turning it over to you. Make sure you wear a mask at the rental office and try to pack your own food for the trip. Since you'll probably have to use a bathroom or fill up gas along the way, wear a mask when exiting the car, do your hand hygiene, and don't touch your face. At the gas station, I would also use paper towels to hold the pump, adding that you should sanitize your hands after filling up the gas tank. Another variable to think about. Long drives usually mean overnights at hotels or homestay rental properties like Airbnbs. It's safe to stay in hotels and rental properties better. It's a toss-up. The hotel industry is working hard to make things safe for everyone, but people still have to touch door handles to get into a room, and potentially come into contact with other people or contaminated surfaces. Within the room, you hope they've done a thorough job of cleaning it for you, but that's a level of risk to consider. The same goes for rentals. Even if someone has come in and cleaned it carefully, we hope that the people doing the cleaning have been careful. They might be carrying the virus themselves. The likelihood that you're coming into contact with fewer people at a rental property versus a hotel may lower the risk slightly, especially if hosts separate bookings by a few days. If you get to a rental property and it's been empty for several days, the chances that you'll pick up anything from that property are small. It seems that the virus does not survive well on surfaces beyond a few days. If you can afford it, consider booking a buffer of a few nights before you arrive, for peace of mind. Whether you choose a hotel or a rental, bring along a lot of sanitizer and wipe everything down yourself, especially the bathroom. Presumably there are clean linens on the bed. I wouldn't worry too much about that. Avoid getting on an elevator if there are too many people on it. Use the stairs if you can, and try to use your elbow or a glove to push the button. Always wear a mask in an elevator, and wash or sanitize your hands afterward, in case you touch a contaminated button or surface. To share a vacation house with friends or relatives, hanging out with people you love for a week or two can be one of the most exciting parts of summer. And in popular vacation areas where rental homes book up way in advance, many traveler already arranged shares long before the pandemic took hold. Is it safe to go through with those plans? It all depends on how careful the people in your group have been about minimizing their exposure. If you're doing a vacation with somebody, you need to know how safe they've been and if they're following all the precautions. If someone has immunocompromised status, I wouldn't want to take that risk. Is it safe to take a vacation? It depends. But any city in the summer of 2020 likely won't offer the experience you had in mind. A lot of activities that people go to a city for are not available right now. Even if places are opening up, access is really limited. From a COVID perspective, it would be safer to go on a vacation where you're able to do more outdoor stuff rather than have exposure to people. It's all about having control over the environment you're visiting, as opposed to trying to go to a museum or aquarium and there are 400 people all around you. To go for beach vacations or hiking trips, if not, many people are around, I would say beaches are relatively safe. I wouldn't worry about the water so much as I would about distancing from other people. Hiking or camping vacations also make it easier to stay away from others. Of all the non-essential travel, it's probably the lowest risk because you can socially distance. But it's important to remain cautious. At campsites or picnic grounds, in particular, keep your own social group apart from others, wear masks, and wash your hands. Try to stay within striking distance of a hospital. You don't want to fall ill in a setting where medical care is sparse. Consider the chance that you might fall ill at your destination when planning any trip. Take extra precautions if traveling with kids. As parents of small children are discovering, keeping masks on little faces can be a struggle. Ditto keeping tiny hands away from faces. The better luck you have on both fronts, the less risk you're introducing to the trip. In general, kids have not had as severe disease from COVID-19 as the adults, but there have been severe symptoms with kids, particularly from the Kawasaki-like disease now known as MS-C, multisystem inflammatory syndrome in children. Kids can also be a source of infection for the adults. It's probably safer to do less travel with kids right now to protect the whole family unit. Visiting elders or people with compromised immunity, plan to self-quarantine in a separate home for 14 days after you arrive, before you go visit your loved ones. During that 2-week period, avoid going anywhere, even to the grocery store. The 14 days is what we're using as the exposure window, based on the information we have now. When you do go visit, everyone should wear masks. And don't forget social distancing, as hard as it may be. I still tell people to keep a distance, stay in the backyard, and try not to kiss grandma or grandpa. I would be very cautious about exposure to those folks. It's unfortunate because you want to see them and they want to see you. But you may have to be satisfied with a Zoom meeting. We are all tired and exhausted during pandemic, a lot of changes, adjustments and so many things that we gave up in life. We don't know how long this will last. For the meantime, stay safe, stay strong and try help one another as much as we can. Please like, share and subscribe to my channels. Thank you for watching. See you on my next video. Ma salam.